everyone, this is Aishwarya and Varsha back again with yet another role play card discussion. And today we have brought a new situation for you, that is merge situation. As the name suggests, we are merging or we are bringing together two different contexts. Right, Varsha?
യെസ് സോ ഈ പറഞ്ഞ പോലെ തന്നെ രണ്ട് സിറ്റുവേഷൻ്റെ merging ആണ് ഇവിടെ നടക്കുന്നത്. സോ എന്താണ് ആ സിറ്റുവേഷൻസ്? A merge case indicates a cluster of two different cases, that is a home visit plus a without introduction case.
Exactly. And you just mentioned about without introduction case,
Yes.
right? So when we are having a communication with our students, we came to know that they will be only looking for the keywords like you have just examined അല്ലെങ്കിൽ you examine എന്നുള്ള കാര്യം മാത്രമാണ് എല്ലാവരും നോക്കുന്നത് in order to identify it as a without introduction case. But for your understanding, we wanted to tell you there are other keywords as well. Nowadays, they are asking in your role play card. They are you have just cleaned or you have cleaned, you checked, you completed, you just finished. ഇങ്ങനത്തെ കീവേഡ്സുകളും അവർ without introduction role playക്ക് ഐഡൻറ്റിഫിക്കേഷൻ ആയിട്ട് തരാറുണ്ട്. So for today, we have gone with the setting, that is
The setting is a home visit. You are a nurse visiting a 50-year-old patient who has had fever and cough for the past 2 weeks. His or her GP asked you to assess the patient. You have examined the patient.
So let's begin the role play. During the time of role play, how can I address you?
So you can call me Varsha.
Thank you.
So shall we start then?
Yeah, sure.
Yes, you may start.
So thank you, Varsha, for allowing me to do your examination. And as per the examination, your temperature is at 100 degree Fahrenheit and your pulse rate is 82 beats per minute. Along with that, I could see that you're having dry cough as well. But you don't need to worry, everything will be all right with you. But before proceeding further, I would like to collect more information from you. So shall I?
Sure, nurse.
Okay, then on that note, could you please tell me regarding the onset and duration of the condition?
Okay, so the problem started, it's been 2 weeks as of now, and I can tell you that it has increased during the night time.
Alright, so do you have any allergies before?
No known allergies.
Okay, then could you please tell me about your past medical conditions?
Yes, I have a known case of COPD.
Alright, so have you taken any medication for that?
No, nurse, I haven't tried on any medication. So what I do is I work on certain, home remedies.
So as per our discussion and our findings, Varsha, you may have the possibility of whooping cough. So have you heard about that?
Well, nurse, I'm hearing this term for the very first time and I'm getting too much tensed of it.
Okay, I can totally understand your situation, but you don't need to worry. I'll explain you everything in minor details. Alright? So when it comes to whooping cough, it is also known as pertussis. It's a very contagious respiratory disease caused by the bacteria called Bordetella pertussis. But you don't need to worry because different treatment options are available in the market. So everything will be alright with you very soon. So is it clear to you?
Yes, I got an idea. But at this point, I just want to ask you, could you please tell me more about the symptoms? Like what are the symptoms this condition might have?
That's a very reasonable question from your side, Ms. Varsha, and I'll explain you everything in detail also. So when it comes to the symptoms of this particular condition, you may feel high temperature, frequent cough, breathing difficulty, runny nose, cyanosis, sleeplessness, and you may also feel thirsty, muscle weakness as well. But you don't need to worry, everything will be alright with proper medication and treatment plan as well. Is it clear to you?
Yes, nurse.
Alright, so I just want to ask you, do you have any of these symptoms?
Yes, nurse, I want to mention a few symptoms which I have at present, like fever, cough, tiredness, I have headache and also runny nose.
Alright, Ms. Varsha, and I really appreciate you for explaining all the symptoms without hesitation to us, which will help you with better treatment. Alright, so do you have any other questions now?
Well, nurse, I want to ask you about the treatment options and also what are the preventive measures that I need to focus on?
Yes, definitely I'll tell you that because it's our responsibility to educate you regarding the treatment possibilities and preventive measures. So shall I start with that?
Yes, please.
Alright, Ms. Varsha. First of all, I would love to start with the antibiotics which we are going to provide you with. They are erythromycin and clarithromycin. Is that clear to you?
Yes, I got you.
Okay, now let's move on with the preventive measures. It's very important you to take plenty of fluids in your diet. You can include juices, soups, etc. Along with that, it is necessary to go for salt water gargling, adequate amount of rest, and wash your hands with soap and water is also necessary. Will you be able to do that?
Yes, nurse, so I'll definitely follow your advices.
That's really great. Now I want to tell you one more thing. It's important for you to monitor your breathing and administer oxygen if it is necessary. Will you be able to do that as well?
Yes, nurse, definitely. I listen to your advice. I want to ask you one more question, which is an important one. So, what about the complication, nurse? Will you be able to help me with that?
Okay, Varsha, I understand your question and I respect that as well. And I'll explain you everything in detail also. Yes, there are slight possibilities of complication in your case, like apnea, pneumonia, convulsions, and encephalopathy. But you don't need to worry, we will be treating everything with proper medication. And you are under our treatment also. But if you find anything going out of control, please don't hesitate to seek medical attention immediately. Will that be okay?
Yes, nurse, that's a good information that you provided me.
So, do you have any other questions now?
No, nurse, I don't have any concerns. I can tell you that you have clarified all of my questions and I feel much relieved.
It's good to hear that, Miss Varsha. Now, I just wanted to tell you, please don't hesitate to approach us or contact us if you need any assistance at any moment. And we wish you a speedy recovery as well.
Thank you, nurse.